Episode 37 F Nasha Ghana, UN declared clean air is a human right, PM 2.5 monitor training, and residential wood burning, compared to Ghana, PM 2.5 emissions. Nasha noted that the focus of residents against wood smoke emission particulates, RAZAB, is on the health effects to near neighbors of living next to residential wood burning, in those hyper-localized areas where the source of particulate pollution, PM 2.5, is concentrated. PM 2.5, particulate matter of 2.5 micrometer size, is the perfect size to infiltrate the human lung, causing a cascade of human health problems. Wood smoke consists of 90% PM 2.5. Residential PM 2.5 monitors can be purchased by neighbors from Purple Air for less than $300, and their locations are put on the online Purple Air map, along with data uploaded every 10 minutes, available to the general public, and of course to governmental authorities. Neighbors of residential wood burners would like their Purple Air PM 2.5 monitor data to be used to regulate and shut down residential wood burning at neighbors' fence lines that exceeds the World Health Organization, WHO, standards of 5 micrograms per meter cubed or future U.S. standards of 8 micrograms per meter cubed. There could even be court-ordered monitoring using a neighbor-owned Purple Air PM 2.5 monitor as a breathalyzers, similar to car breathalyzers court-ordered for repeat drunk drivers, to turn off the ignition of a neighboring indoor wood stove when levels of PM 2.5 in a near neighbor's yard is exceeded. In this way, governmental authorities would not have to check the make and model of an appliance and would not have to rely on unreliable certification and other worthless assurances of levels of wood stove particulate emissions by the company that manufactured it. Purple Air monitors also provide data every 10 minutes 24 hours a day, and data can be downloaded from the map by governmental authorities the day after the PM 2.5 levels are exceeded during normal government working hours. Purple Air PM 2.5 monitors are so reliable and accurate, they are put on U.S. Air Now smoke and fire maps alongside Environmental Protection Agency (EPA) monitors, correlated to the EPA monitors with a simple mathematical formula. But to publicize this, it is necessary to point out that living hyper-localized next to a residential wood burner is essentially the same as living next to residential wood burning for lighting and cooking in Ghana. One participant in training cited training in using a personal air quality monitor as transformative. The notable fact of the article that Gerda read about Ghana training healthcare workers to recognize and teach about air pollution which affects the health of Ghanaians was that particular kinds of air pollution, such as residential wood burning, were not specified as sources of air pollution. The World Health Organization, WHO, is piloting a program to train health professionals as advocates for clean air policies and programs with the ultimate aim to protect and promote people's health and well-being. Health workers from all corners of Ghana met in Kumasi, Ashanti region, and provided input into the program. This successful pilot is expected to expand into a global program in 2023. Health professionals shape the dialogue on air pollution and health topics, both through direct engagement within their communities and peer colleagues. WHO is piloting a program to train health workers to advocate for clean air measures in the communities where they work. The project is led by the Air Quality and Health Unit within the Department of Environment, Climate Change and Health. The global training curriculum is designed to be tailored at the regional and country level. Pilot workshop in Ghana. In Kumasi, Ghana, in June 2022, a group of almost 50 health professionals gathered to test the program. It allowed them to gain the skills and knowledge to act as trainers with peer colleagues in the health sectors and the communities they serve. Training covered air pollution and health as well as specific modules for clinicians addressing cardiovascular and respiratory diseases and the health effects of air pollution on children and pregnant women. Clean air as a human right. In August 2022, the United Nations General Assembly passed a historic resolution declaring that everyone on the planet has a right to a healthy environment, including clean air, water, and a stable climate. We have made air, the thing that keeps us alive, the number one threat to our health, said the head of Secretariat, Climate and Clean Air Coalition. By formalizing our right to clean air, this resolution is an important step towards protecting both people and planet. The training toolkit being developed by WHO is designed to reach those planetary health goals. 99% of people worldwide breathe air that exceeds WHO global air quality guidelines. Regions and countries differ widely in their burden of air pollution, low and middle income countries being the ones whose population is most affected by this threat. In Ghana, this is a serious concern for public health. Ghana's annual ambient mean concentration of PM2.5, 35 UG/M3, largely exceeds WHO global air quality guidelines for particulate matter, PM. Households' heavy reliance on unclean fuels and technologies for cooking significantly contribute to air pollution exposure and important health outcomes in the population. Health systems pay the price of illnesses that result from air pollution exposure. Therefore, the health sector has a vested interest in improving air quality and advising patients and individuals on exposure reduction strategies. A public health officer for disease control says that as a result of the training, I'm equipped. I now have the knowledge to go orient my other staff and also be an advocate for clean air. An employee from the Ghana Health Services in the central region of the country appreciates that trainees had the opportunity to conduct field visits, including to use air quality personal monitors, while appraising firsthand the sources of air pollution in the Ashanti region. He notes that air pollution is one of the major causes of respiratory and cardiac problems. He says that we know that one of the major causes of asthma, cardiovascular diseases, and other conditions are due to air pollution. He believes this workshop is timely and hopes to implement the modules in the program to reduce regional exposure to air pollution. Health workers listen to presentations from WHO staff and other experts from the University of Ghana and Wonka Global Family Doctors, and work together in small groups to figure out how to best implement policy and clinical approaches to air pollution within their specific local contexts. A reduction in air pollution emissions is a win-win opportunity to simultaneously protect human health and the environment and to address the complex challenge of climate change, as the combustion of fossil fuels and residential wood burning contributes to increasing the levels of some air pollutants.